I'm Carrie Maholsky, Certified Nurse Midwife from Thrive Midwives, and today I wanted to make a video to show you some of the things that I carry in the birth pack that I'll bring to your home for a home birth. Sometimes people who are not well versed in what home birth looks like thinks that we may just bring a little bit of pixie dust and unicorn horns and maybe some incense to burn, then that'll be sufficient. But just like hospital and birth center providers, we bring a lot of things with us just in case there's an emergency or the need arises for them. The first thing, of course, that I bring is a Daptone. The Daptone is the primary tool I use in order to listen to your baby routinely throughout your labor and before your birth. Also, the dreaded blood pressure cuff. The wonderful thing is that most women who have home births are low risk, and so taking blood pressures every 15 minutes, every half an hour, or leaving a blood pressure cuff on like you'd see in a hospital, that's just not common. What we do is we assess your blood pressure when we first come to your home, and if it's normal, we usually don't assess your blood pressure for another 4 to 6 hours after that, and of course postpartum as well. The next thing I carry with me, I have 2 out of the 3 of them: Pitocin, Cytotec, and I've got Methergin over in the fridge. Now these are the same medications that I used in the hospital for women who bled more after birth than is anticipated or healthy. These 3 medications, which work slightly differently and are appropriate for different people, is used to treat and to prevent postpartum hemorrhage. Rest assured that these can be addressed safely and efficiently in a home birth setting. I also carry several herbal tinctures with me, including Angelica. It can help with women who are bleeding a little bit more than anticipated but are not interested in using a medication. It can also help with women who have placentas that don't seem to be very interested in coming within the expected 30 minutes after a birth. I also have something called a pulse oximeter. Now, if for some reason your baby is born and needs a little bit of help, using a pulse oximeter if we need to resuscitate a baby for any reason is really important because it helps us know whether what we're doing is helping the baby. Another thing that we use it for is when you have your 24-hour visit and I come out to your household to check on you and the baby. I perform what's called CCHD. It's using the pulse oximeter on your baby's hands and feet in order to make sure that your baby is oxygenating its blood appropriately. It is looking for potential signs of a critical cardiac defect. So that's another thing that I bring in order to safeguard the health of your baby and to help me do my job a little bit better. Those are some of the things that I carry in my birth bag with me to home births. Thanks for joining me today. Hopefully this has helped inspire you or encourage you to realize that home birth for low-risk moms are very safe, in particular when they're done with a very highly skilled and qualified provider. Thanks for joining me.